Okay, what about the dumping syndrome, and what about eating after surgery? Well, the dumping syndrome is viewed by certain other surgeons as this really frighteningly dangerous problem. And the dumping syndrome can be very upsetting, it can be painful, it can cause weakness and dizziness, but if you kind of know what you're doing, it shouldn't be a problem. First of all, any of us can get dumping syndrome right this minute if you just had a great big bottle of regular Coca-Cola and a giant chocolate cookie with a spoonful of sugar. For about a half an hour, hey, this is great, I can work all day, and then all of a sudden it'll be crash. You can have a low blood sugar, which causes weakness and shakes and sweats, and you feel terrible. That's hypoglycemia, and that's called type 1 dumping, and that can happen after the MGB if you had a whole lot of that sugary sweet smoothie that you just made. If you happen to throw into there a lot of sugary type foods, your sugar would burst up in your bloodstream, your insulin from your pancreas would come rushing in and overdo it and might be low, and it'll have a low blood sugar for a while. And the solution is not so much, not so fast. So the dumping actually helps protect you from eating tons of sugar fast. Well, good. So we're going to tell you, if you try to eat tons of sugar fast, I will fly up to your house in Oregon, walk into the house, and punch you in the stomach. Dr. Rutledge, what are you doing here? Oh! Okay? And now, can you have that sugary sweet smoothie in a very measured and slow manner? And the answer is yes. That way, no problem at all. Take it easy. Do it gently. Small amounts, very slowly, no problem. Take a whole big gulp. Get excited talking with the family, watching a football game. Oh, this is great. I think that's Dr. Rutledge at the door. Okay? There is another kind of dumping, though, with much more devastating and crippling pain. The hypoglycemia gives you kind of weak and dizzies and things like that, and tremors and sweats and things like that. That's called type 1 dumping. There is something called type 2 dumping, and I want to remind you of a scary movie called Alien. I don't know if you've ever seen it, but the little monster crawls out of the guy's tummy. Can you imagine that'd be uncomfortable? Ah! Right. That's type 2 dumping. Now, how does it happen? Well, I want to first talk about little tiny toys you can get at the checkout line of a lot of toy stores, and they look like almost like a tablet of medicine. And they say inside here is a 6-foot sponge dinosaur. And you put the little tablet in water, and this big sponge dinosaur comes out, right? Now imagine in your mind if you swallowed 10 of those tablets, and all of a sudden they dissolved, and the big dinosaur tried to come out in your stomach. Can you imagine that would hurt? That's type 2 dumping. It's caused when you eat like a hot dog and bun and eat it too fast and it drops into your small intestine through the MGB, then it begins to suck water in and it begins to expand like it's going to burst, like that alien monster coming out of your stomach. That hurts. Okay? Here's a story. One of my patients was at Disney World. The kids were having a great day. He was having fun. He had never been able to go on the rides before. He was out having a great time. And he fell down in the middle of Space Mountain and the line for Space Mountain, clutching his chest in terrible pain. His wife called me with the ambulance blaring in the background, riding. She says, "I'm chasing the ambulance in my car. My husband's dying of a heart attack. Tell me what to do. Is it the MGB that caused this?" And I said, yes, it is the MGB that caused this. But I said, tell me what he was eating. No, you don't understand. He's having a heart attack. We're on the way to the hospital. Please, Dr. Rutledge, you've got to help. And I said, tell me what he was eating. No, you don't understand. I said, well, you know, as he was laying on the ground, I remember now, he had a hot dog bun and a hot dog in his left hand. And so what turns out, he went to the hospital and he didn't have a heart attack, but he got excited. He was having a wonderful time. He was there with his kids, and he ate a lot of hot dog bun. It went down into the stomach. That dry bun sucked in water, and he was in terrible pain. Okay, story number 2. And I could tell these stories all day long. Story number 2 about type 2 dumping. I operated on the wife of the president of a very famous Southeastern university. And so when she came to have surgery, they flew her in a private jet that had university on the side and everything, and they introduced me. This is Chancellor so-and-so, and that's his wife. And so thank goodness the surgery went well. But about a month later, the Chancellor's office says, this is the Chancellor's office at the university. Dr. Rutledge, the Chancellor needs to speak with you. And I go, yes, sir. You need to talk with my wife. She's in terrible pain. And so she was also just writhing. I'm in pain. Oh, Dr. Rutledge, something's wrong. Oh, my goodness. Oh, my goodness. I said, tell me what you eat. Oh, no, it's not. I'm just pain. I said, tell me what you ate, you know. And she said, well, I got up this morning and there was some quiche in the refrigerator from last night. So that's got protein and fat. And she ate 2 big slices of quiche, and it tasted great until the little alien just started to come out. So that's type 2 dumping. Now, the quiche would have been fine if she'd had 1 bite. But type 2 dumping is you put a bunch of food, too much in the small bowel, and it sucks the water in, just like a sponge, and stretches like it's going to blow up the small bowel. So again, the solution is don't eat a whole bunch of quiche fast. Don't eat a hot dog fast.
So is this a long-term prospect?
That's forever. You may never, ever eat a whole bunch of bad food fast ever in the future. And in fact, isn't that what you would like? You would like a governor on your ability to eat junky, crummy food. Now, can you have a hot dog? Yes. Small amounts, well chewed, slowly. Do you want to have a heart attack? Eat a hot dog fast. I will come to your house. That's type 2 dumping. And that's what you get with the surgery. But can you eat cheesecake? Sure. Can you eat a whole cheesecake? Don't even try. Lo, I am with you even until the end of time.